All right, next we got health informatics careers. And if you look at the word root information, there we go. They're focused on the patient's information. And so with them, they look at the documentation, how we share information or data in the healthcare setting. So they enter, retrieve, maintain all that a patient's chart. Like right now, I could call any facility that I've been to or a patient I've been at the hospital where there's doctors or university. I could call them and say, hey, I need a copy of my medical records from, 2015. And they'll say, okay, give us a couple of days, we'll have it. That's what health informatics technicians or careers are all about. One of the big things with them is patient privacy and protecting patient health information. So this is where like my IT people, my computer people, y'all, this is where y'all come in. Because like right now, I don't know if you've ever been to have you been to a hospital lately, but everybody uses like iPads, right? Little tablets, laptops, that kind of stuff to chart, to look at test results, all that. And health informatics, without those people, we probably would like fall apart. So when the computer starts messing up, we call them. Right? If I can't access my patient's records for some reason, we call them and they'll go in the system and fix it. It's so amazing. And they do all this from the comfort and safety of wherever they are, unless it's like a hardware issue with the computer or the laptop or whatever, then they come out. But otherwise, they can do everything they need to do, like with software, retrieving patient data, sending information. They can do that from their office. That's normally like in another building somewhere or, away from the patient care areas. So this will be the one for people who are not too excited or thrilled about the blood and all that stuff with healthcare, with taking care of patients. Okay, so here are some examples of careers that fit into this category. Healthcare administrator. So like if you want to be like, I want to be a CEO, right? Or like I had planned to be, I want to be over all the nurses in the facility, that kind of thing. Admissions clerk. So like when you go to the hospital, the person that checks you in, like they're in health informatics. A health educator, like there are people that have jobs in healthcare that basically train the workers on whatever they need to be trained on. So like I'll give you an example. We recently got new IV pumps, like they're made by a different manufacturer. They're really awesome. They do a lot more than just regular IV pumps. Our health educator is the person that sets up the classes and training for us to come in and learn how to use them before they go live. We always say go live before they show up on before we start using that equipment to take care of patients. It's a pretty awesome career. Probably no stress really. So that might be something y'all might want to do. Epidemiologists. Those are the people who take information, like right now, perfect example, COVID, right? I don't keep using that as an example, but it's so relevant for us healthcare workers. What an epidemiologist does is look at trends. They follow information, data, numbers, as far as like how things are going, for whatever the disease outbreak or process that's happening. For the CDC, and I know y'all probably heard that term if you watch the news at all recently, their role is basically to watch different states and counties and regions of the United States. And they're the ones that tell us what issues are becoming a problem for our country and what we need to focus on health-wise. So we know diabetes is an issue in the South, right? They call it the Sun Belt. That's because the epidemiologists got all that information from various healthcare facilities and physicians and other practitioners, and they combined it, analyzed it, and came up with conclusions about what's going on. So they are like the masters of health information. Like they use it to help all of us, like in the whole country, be better and healthier. It's pretty great. So epidemiology may be something that some of you are interested in, especially if you love numbers and analyzing data. So something that, okay, yeah.